Mrs. Brooks. And now we go to Mr. Schrader from Oregon.
Thank you, Mr. Chairman. I want to thank everybody here for all the hard work you're doing. But I'm concerned, very concerned, that the American people are laboring under some gross misapprehensions as a result of some of the information that's out there. Dr. Fauci, what's the average time to develop a vaccine? Mike, please.
It depends on the vaccine and the situation in which you're doing it. If you're developing a vaccine in the middle of an outbreak,
I'm just asking, what's the average?
About 7 years.
All right. And what was the fastest we've ever done? What's the quickest a vaccine's been developed to date?
Well, it's probably, I think the Zika vaccine, which we developed, was about 1.5 years, but it was never brought to full fruition because Zika kind of disappeared.
So and say there is a vaccine, what's the probability that a vaccine comes to market, actually?
Oh, if it's successful, it's a high probability.
No, I'm just saying, all these vaccines we got out there being developed, what's the probability they're going to make market entry?
There are more failures than there are successes.
It's about 6%.
Right.
What's the chance that even with a vaccine, this virus will be eradicated? And I'd look to flu for a little bit of an example, influenza. How effective is that vaccine?
The influenza vaccine is variable because the virus changes rapidly.
Much like this virus.
We don't know that yet.
Well, we already know it's mutated, right?
Yeah, that doesn't make any difference. All RNA viruses mutate. That doesn't mean they change.
Well, if I was a mother or a hardworking American citizen, and and I'm trying to bank on my family's future, how long do I wait? We're very worried that many, many Americans are waiting until there is a vaccine, maybe 1.5 years at best, out there, and that's going to be the panacea, and they're all going to be okay. No. I think that's a terrible, terrible miscalculation. I'm not blaming anybody here, but it's a terrible miscalculation on the part of many Americans, and I'm going to stay home, not go to work, not send my kid to school, and I'm going to hunker down, and I'm going to be okay. I'll just wait for that vaccine. I think we have to start talking in terms of vaccine as one of many tools in the toolbox so we don't end up in particular problems. Dr. Redfield.
I agree with you completely.
Well, I need to get out there a little bit more. Dr. Redfield, to that end, I'm very concerned with the school year coming up. The CDC never recommended closing schools this spring, and yet many, many, many school districts across the country closed. Right now, the CDC guidance talks about different considerations. How likely is it that a second grader, or frankly even a teenager, is going to maintain social distancing of 6 feet all the time?
I think you know the answer to that, Congressman.
All right, thank you. It's a rhetorical question. I appreciate that. How about a school bus, where you're supposed to have one child per row? School districts, maybe in some states, are much more flush with money than mine. We can barely afford the school buses we have now. What's the chance of having, 3 foot or less?
Yeah, I think you raised the reality as we look at.
I'm just concerned. I'm sorry to interrupt. I have limited time, but some of these are rhetorical. But I'm just worried that we're making all these pie-in-the-sky public health perfection recommendations that have no chance in hell of actually happening at the local level. They don't have the money. They're dealing with human nature, especially children. Look, adults aren't much better from what we can see around the country. But poor children, we have to have recommendations, I think, that are realistic. What's the incidence rate of this disease in children?
We still don't know the infection rate in children, but we do know when you say
internationally,
disease,
it's less than 2%.
When you say disease,
Dr. Fauci makes the correct comment that, but they can infect others. It would seem to me a smart use of our precious dollars. You talk $7 trillion. We don't have $7 trillion, Doctor. We spent over $3 trillion, which is twice what we spend in a year. We did that one bloody month for a good reason. And hopefully, you guys are showing us good results, and I appreciate that. But we need to make sure that citizens out there aren't withholding Johnny and Susie from going to school because they think, this is all going to be over in a month and a half or 2 months. That's what the president tells them. That's what we're telling them, or they're getting that impression. That's wrong. And if we have kids not going to school, we run the huge risk of the wealthy kids get a great education online with their nice moms and dads. The lower income kids get no education. And
the comment I would like to make is that it's so important, the inference of what you're saying is we need to use the knowledge that we have now, which we didn't have then. As you know, CDC did not recommend closing schools.
yes, sir.
Okay?
Thank you
And
for
we
that.
didn't recommend it because we didn't think it was a one-size-fits-all. We close schools jurisdiction by jurisdiction when we see issues in the schools. So I do think we have to focus as we move forward in the fall and now, what I said before, on the consequences of this virus. And those consequences are mortality and hospitalization and the economy, right? And I think when you see that, you'll see that different recommendations for the jurisdictions will come to rise. And as I said, I'm pretty confident we're going to be opening our schools, and your comments are true. We need to open our schools with the reality of how we expect those schools to act based on the consequences of what we think this virus is going to pay for those individuals in school. That doesn't mean we don't have to be vigilant about protecting the vulnerable. You need to work on that in those families, but no longer does that mean we have to shut down schools, shut down the economy. It means we have to focus on how to prevent the consequences of this virus.
Thank you very much. I'm sorry for the line of my questioning.
Thank
I
you.
yield back.
Now